The middle-aged man is only identified as Appiah and is believed to be in his early 30s. He was admitted to the emergency unit of the 37 Military Hospital in November 2023 by a Good Samaritan after he was knocked down by a speeding vehicle on the Accra-Tema motorway. All attempts by the hospital authorities to reach the family has proven futile. The ward in charge of the neurosurgical ward of the hospital, Major Emmanuel Insifo, says doctors and nurses in the hospital are left with no option than to take care of him from their own pockets.
The person who brought him initially was cooperating, but along the line decided not to follow up anymore. So we've been able to take care of him till a point that he was ready to go home. There wasn't anybody coming. So through our command and then through our Department of Public Relations, we were able to send a picture of his to the social media, and then people started coming. Then we had a friend of his who finally showed up and then mentioned his name. So before then, or before now, he was known as Unknown Monday. But when the friend showed up, he was able to tell that he's called Appiah, and that was all that the friend could give. He was able to tell us that he knew him from Koforidua and knew some of the relatives at Koforidua, so he will make you do follow-up for us. He did the follow-up, and then unfortunately, it came out that the relatives that he knew that were at Koforidua had relocated, and he didn't know where they have relocated to. So currently, we are looking at ways of getting him a permanent place.
Major Emmanuel Insifo called on government to strengthen and resource social welfare institutions in the country to provide for persons like Appiah.
He is okay to go, but where is he going to? So if we had a function or a well-organized social welfare agency that is able to take care of some of these victims, I think it will go a very long way. As he's lying here, he's occupying a bed that someone who is in an acute state or who is an emergency state would need. But because he is on that bed, we can't bring another person who needs it most than he does. So if we're able to get organizations, if we're able to get government institutions that are well-equipped, well-resourced, it's not just the institutions, but well-equipped and well-resourced to handle some of these cases, it will lessen the burden on the ward and equally give other people the opportunity to survive if there are spaces here to admit them.
President of the Accident Victims Support Ghana, Reverend Cyril Crab, leading the group to make a donation of items including toiletries and consumables, advocated for more support for accident victims.
It's something we've set out to do, and we have been doing over the years. It's a decade and more. And so coming here today is one of the things that we feel the joy to do anywhere, any day, anytime. But notable of them that we want the country to know is that we've looked far from these people already. Crash victims I'm talking about, we've looked far from them. It's just like any other disease that can kill. The moment you set out on the road and you are in a car and you set on the road riding to your workplace, have it in mind that casualty is part of it. If you are out of it, then the Lord has been good to you. But when you fall prey to it, which of course it can happen to everybody, let's try as much as possible to come around and then help these people. Especially in this month of February, we think that we should set the pace. If there is any kind of love we should show to these crash victims.
Major Insifo expressed gratitude to the Accident Victim Support Ghana for the donation.
Almost everything that we do for him comes from contributions that we do as staff, and then other benevolent persons and then groups. If they hear about him and it touches them, they come along with some of the personal items that he will need. Because being here, he will wear diapers, he will drink water, he will eat. There are some basic things that he cannot be denied of. And definitely if relatives were around, they would have provided those things. And since relatives are not around, then we as staff of the ward have to take it upon ourselves. So we do a lot of contributions. So the Accident Victim Support Organization coming in to bless us or bless him with these items, it will go a very long way in the care that we will give to him whilst he's still with us till the very good time that he will leave us and go to another place.
With Appiah responding to treatment, authorities of the hospital are encouraging anyone with information which can help identify the family of Appiah to reach out to the hospital. Prince Kwame Kudoge's report for Joy News.